honorable members of the public, journalists, intellectuals, professionals, friends and families, ladies and gentlemen, good afternoon. It's a great honor and privilege for me to meet you here at the historical place of Sheffield.
I missed the first few sentences. I thought that
I would like to welcome you all who have been traveling from far and distance to join us at this magnificent get-together for the freedom. Without your support, this was not possible. And I have all regards for you who have been traveling from distances to meet up together. We're going to make a day. Our homes may be hundreds and thousands of miles away.
Is that the maximum?
But the cause is common. That's where we're standing today. For the freedom, for the liberty, for the livelihood, and regain our rights. Recent lockdown has threatened the livelihood of the entire population of the world across the globe, with devastating effects on the economy, on the trade, on the business, on education, agriculture, industry, you name anything that has been affected terribly. Across the world, 7.8 billion people are suffering from this as a result of this lockdown and atrocity. But we are standing here for the unity, peace, love, and tranquility. 23rd of March 2020 was the historical day, and it will always be remembered when lockdown was imposed on the public of the United Kingdom by the flawed biological mathematical model from Imperial College. We were told that 8 million people would suffer due to infection of coronavirus and 500,000 people would die. As a result of this false claim, the entire UK was locked down. That would be considered as a dark spot in the history of the United Kingdom. As a health practitioner working for the NHS for the last almost 30 years, I am a consultant surgeon. I qualified from Royal College of Surgeons. I am a general surgeon and I do bowel cancer surgery, I do breast surgery, and I'm an emergency surgeon. I have saved thousands of lives in this country. I was part of one of the NHS trusts when the lockdown was imposed. I am the witness of the lockdown, atrocities of the public, loss of freedom and health services by the NHS towards the public. On 23rd of March, as per record says, there were 2.6 million people waiting for their investigation and treatment for the cancers. Now, the figures have gone over 4 million. And the waiting list was 3 million at that time, but now the waiting list of the patient for their surgery, their investigation and treatment has gone over 6 million. And NHS has admitted this will take 10 years to clear the lot, which seems to be impossible unless the extraordinary measures for the people are in place to clear the lot. That's what we are standing for. That's our entire motto is here, for the rights of the public, for the rights of the people who have been paying taxes, but their treatment has been banned, has not been seized off. The hospital admissions have been has been totally seized off during that time. Only emergency surgery was working. I was part of the surgical team, and I have been operating all the COVID-19 patients which came to me with a bowel dissection and all the major surgical procedures I've been carrying out and saved lives. I had unblemished record for 30 years over NHS. And I take care of my patients and look after them. I stand for the humanity. I never believe on going against the humanity. I believe on humanity and equality. I never ridicule anybody on the basis of the religion, color, race, individuality. I treat everybody on equal. That's my message. As the lockdown came, 167,000 beds in the United Kingdom, including the private hospital, were told to be vacated for the expected COVID-19 patients. 1,246 hospitals were given the directive for clearing the beds for the expected COVID-19 patient, but we have not seen that happening. On that Imperial College biological mathematical model, the patient have been suffering because they were told not to come to the hospital. There was a slogan, stay home, protect NHS, save lives. We have been saving lives, but patients have not been going to the hospital. They have protected the NHS, which the right of the public has been compromised. So that's what we're standing for, the human rights and the public rights.
Yes.
Recently, I have seen a directive a couple of days ago from Department of Health and Social Care Services released on 28th of August asking your viewpoint regarding the vaccination agenda, and does say government of United Kingdom would like to have your opinion regarding distribution of vaccine for the treatment of coronavirus and the flu virus. See the mixture of the words, flu, everybody got a flu, COVID-19 and flu virus. And they have 5 subheadings under that distribution of vaccination. Number 1, authorization of unlicensed vaccine to the public. Are you in favor of that? That's a very important document, and we have been given deadline until the 11:59 on 18th of September. You need to decide whether you want to be having an injection, behaving like a sheep, and tattoo marks on your forehead. That was the first one, authorizing unlicensed vaccine to the public. 66 million people in the United Kingdom. They are very sensible people, highly educated, very civilized. I have a lot of respect for all of you. I'm part of this system of 30 years working for NHS, unblemished record. Yes. Number 2, the workforce in place to administer vaccine into the public. Number 3, the civil liberty and immunity. Number 4, promotion of vaccination. And number 5, wholesale selling of the vaccination in UK and in the rest of the world. Can you imagine that, guys? 5-6 months ago, when I said all these possibilities are coming, you must have seen my videos in different languages. Was I right or wrong at that time?
You were right.
I said that. That's going to be implemented, forced vaccination, whether you like it or not. You got to stand against that atrocity and imposing again, nobody can ask you to be injected poisonous substance unless you are willing to do that. I'm a surgeon of 35 years, unblemished record. We get consent form signed by the public, a patient, before doing any operation. Even patient is dying because of any serious surgical catastrophe. If patient says, no, I don't want any treatment, we cannot proceed. Similarly, you have the right to say no to the vaccine and all the poison substances which are going to be administered to you. Here, I would like to remind you and the health professionals across the world who are listening my voice today, with hundreds of people here and millions across the world, that the health professional has given an oath. That is historical Hippocratic oath based on the medical ethics. I have given that oath soon after I graduated from my medical college. That's 35 years ago. I said, I will do no harm to the patients. I will not administer any poisonous substances into public or my patients, and I will never encourage to do so to anyone injecting the poisonous material into my patient. That is the oath which we have given health professionals. I know I must appreciate millions of doctors across the world. They are talking. They have a recent interview of 200 doctors from the United States of America. I was part of that. 600 doctors from Germany. And we have got a fair amount of doctors in the United Kingdom, and more are joining us. Just now you have listened Emmy's verdict here. I do second that verdict because I am part of that. I'm a surgeon. She is a recovery nurse, so we know what's happening inside. And since I've been working in that health system, I know because of that lockdown, 70 to 80% of the hospital beds were lying empty until today. I can witness as a part of the NHS that the imperial model was totally flawed and based on the influenza virus of the study of 14 years ago. But I must confess here that we will stand with the public, with the human rights, with the liberty. We promote freedom of speech, and we promote for health and safety. I said that by the end of April, exactly what I'm telling today, because I'm eyewitness for the atrocities happening in the health system and across the world, leading to devastating effect on the economy, on the education and the health services. I said exactly the same thing a few months ago. On 22nd of April, I was dismissed from the service. That was my fault, that I went to social media and expressed my viewpoint. Under Article 10, Human Rights Act, I can hold my opinion and I can express myself. That's why I did. I went to the YouTube. I was taken very seriously by my regulator, and they called a meeting. And they summoned a letter to me that I need to appear in front of the interim order tribunal of the General Medical Council, which is usually a last stage before they sanction anybody. Nobody told me before that is a serious issue. I still think about it could have been better option in a respectful way to ask me to come round the table and have a talk and what exactly is required. Then I would have convinced them that this is what I'm feeling. But they went straight on the interim order tribunal meeting, and there they suspended me for 12 months. 1st of June, they suspended me for 12 months because of speaking the truth. They suspended me, but they could not silence me. They could not silence me, neither they will in future. So that is absolute unfair dismissal, and I have serious concern about the General Medical Council, its members, interim order tribunal, who have been doing the same thing to a lot of the health professionals. And I've got documents with me. 400 doctors have suicided in UK in last 4 years, from 2014 to 2018. And from August 19 until August 22, 369 doctors have been summoned, they have been suspended, they have been cautioned, warned, and they have taken undertaken, mostly belonging to the ethnic minority. But we talk about the equality and justice. That is not right. So I am standing for that. And General Medical Council document says they admitted that 111 doctors committed suicide from 2005 to 2013. That is the General Medical statement. You should go home and please explore this when you on Google. Type it, how many doctors suicided in health services. They have been penalized. But I would say here, our greatest glory is not in never falling, but in rising every time we fall. And I must appreciate your kind love, dedication, sacrifice, and your time coming all the way to join us. We made this day historical. Bit by bit makes a history. And in conclusion, I would say that the lockdown is totally unnecessary. Because there's more damage, more people have died because of lockdown rather than the coronavirus, having mortality of 0.03 to 0.25%, as described by all the epidemiologists. What were you doing in lockdown for? And what were you planning for? Vaccination when already the virus has died down and there's only infection of virus. We do understand the virus exists, but it's not the way you have been trying to orchestrate. We're not saying that virus is a hoax. Virus does present, as the scientific evidence say, but coronavirus is part of our body. It's a host. And there are millions of strains of coronavirus across in the environment before it came to the knowledge of the mainstream media and the government. And the RT-PCR test designed by Carrie Mullis in 1985, who got the Nobel Prize in 1993, said that this test can be used for the microorganism. On that basis, he got the Nobel Prize. But his test has been used, but only thing is, there's only 50 to 60% sensitivity of this test. The accuracy is 50 to 60%, but 90% people would be positive. But doesn't mean that they need admission, or they should be out of work, or they are the source of infection to the other. Certainly not. Test positive doesn't mean the infection. The definition of infection is presence of the microorganism with the sign and symptom, and the clinical manifestation, which include cough, fever, sweating, and even worse than pneumonia, and that is kind of a symptom. But anybody in this crowd, for example, 200 people standing here, they would test RT-PCR positive, and say 30, 40, 60 people come by positive. Doesn't mean that they need to be admitted into the hospital. That is just a test. And as I said, 90% people will have test positive, but doesn't mean that they are infected. So please clarify your mind from this. Do your work as normal. And we are against lockdown. We don't want a vaccine. Say no to this document. You can explore that on the government website. I have tried to circulate this document to everybody. So you should know yourself before it's too late. I am standing with you. All the health professionals standing with you. You should be able to understand what's going on. It's not just a virus. Virus is a tiny bit invisible enemy. We're not going to be frightened by the virus itself. With all this, I would again thank you very much. And very kind of you to come all the way to participate with us. Is there any question I would like to answer to the public? As I'm a health professional with long-standing experience, you might still have some questions, doubt, or anything I could explain.
WHO changed definition of pandemic from actual sick cases, dead people, to amount of infection. From doctor's perspective, can you understand? Can you explain us so we can understand what should be definition of pandemic, genuine situation?
It is a very good question, actually. There are two things. One is epidemic. When it arises, suppose in Sheffield, there is epidemic. Some disease arises here, that's epidemic. When is pandemic mean? It's uncontrollable, it's not treatable, and it involves the rest of the world. The WHO actually declared this coronavirus, which was detected by Chinese and by end of December, and they actually called that time as a COVID. No, sorry, it's a SARS 219, and then it was a SARS-CoV, and then the WHO actually named it as COVID-19. That was on 11th of March. But they said it's pandemic. But you can see, I can tell you that this is not a pandemic. It has been made look like a pandemic. Okay, remember that. There are a lot of countries which never had this incident, like North Korea, Vietnam, Kazakhstan, Turkmenistan. And in many countries, the lockdown has not been in place, like in Sweden, Denmark, Norway, Vietnam, South Korea, North Korea, and a lot of countries. And they have done better than the lockdown actually. And the government of UK has actually admitted the countries who have not done lockdown have done much better compared to the United Kingdom. So with this, I have got my respectable, honorable friend, Piers Corbyn, whose dedication is always highly appreciated. And he's been traveling across the world, across the country, from one place to another. I really have a lot of regard for Piers Corbyn and his friends.
Thank you very much, Dr. Adil. Yes, Dr. Adil! Yes, after he spoke, I thought, remember, in Trafalgar Square we pledged support from the movement for all medical workers who are victimised for defending the people against the lockdown lies. So we want to repeat that here. We will defend all victimised health workers who are fighting for the truth. Yes! And the way forward, of course, is come to London in massive numbers on the 26th of September. And some people have asked me, what am I doing on the 19th? Because there's other things maybe happening on the 19th. On the 19th of September, I'm going to be at a mass rally in Portsmouth, which is, you notice, very near to the Isle of Wight. So, just a piece of information. But you see, on the 19th, we want to have rallies in towns all over the country to fight against the new normal and build for a mass rally like we've never seen before on September the 26th in London. 12 noon.